We are a unique program in that we offer a generalist public health master's degree, and we are really in the business of preparing public health leaders for the future.
The first thing that caught my attention about the program is that it's designed for working professionals.
I do work, and I didn't want to stop working in order to do a program. The USF School of Nursing and Health Professions has such a great reputation that I knew that it would be an outstanding experience in terms of the faculty and the curriculum.
They're really pioneering some fantastic interventions in terms of public health, and specifically using this social justice lens. I think it's important to be at the forefront of those discussions and those projects in terms of public health.
The University of San Francisco is so well connected in Northern California, so we've got these great fieldwork opportunities that students can do and get out to really interesting places so that it helps them to network and move into their careers and get an opportunity to see what public health is like before they make their career move after they graduate.
I did my field project at the Prescott Joseph Center in West Oakland, and I specifically worked with the Breathmobile program. So the Breathmobile is a mobile asthma clinic that provides asthma treatment and medications to underserved children throughout the San Francisco Bay Area. And the Breathmobile shows up and treats patients that otherwise wouldn't have access to asthma treatment.
I think with the network that USF had in terms of their relationships, their partnerships, who they know in the city, that's fantastic in terms of the scope of work and the types of projects that we could get involved with.
I think that USF really puts practical experience into the classrooms. Dr. Courtney Keeler is amazing. She teaches biostatistics and epidemiology, which were classes I was not particularly looking forward to at the start and ended up being some of my favorites.
Biostatistics is, students always come in terrified. You aren't going to come out of the class as a statistician. But, you know, thinking about things like bias, thinking about things like how is the sample drawn? These are tools that are used in quantitative research, which is a huge part of public health literature. The thing I always tell my students, too, is that we're here to support you, too, the faculty. We really want to help you any way we can.
We really do believe that the future lies in creating systems-level thinkers, as well as thinkers and leaders at the higher level of practice. San Francisco is actually being perceived and viewed as a model city for the United States for national health care. And as such, we are right there at the very foundation of what's going on in public health. And in fact, now is the time for public health to really rise to its significance and its occasion, and to really flourish and prosper in our nation as well as in the city.